Now we're going to take a look at the arteries that go to the lower body. The aortic arch comes out of the left ventricle, forms the arch, and comes down through the chest cavity, where it's called the thoracic aorta, and then it goes through the abdominal cavity, where it is called the abdominal aorta. Once it gets to the sacrum, it branches. One branch goes to the left side, and of course we don't have the left side of the mannequin, so we're not building that. The other branch goes to the right side. These are called the common iliac arteries. This would be the left common iliac, this would be the right common iliac. Common means shared, so the common iliac branches again right here, just where you see the coxal bone attaching to the sacrum. This first section right here is called the internal iliac, and then this section is called the external iliac because it ends up going closer to the surface of the body and more towards the lateral side. Let's go with the external iliac first. Once the external iliac gets to where the hip joint is, so the head of the femur is right over here, it changes names. Doesn't have any major branches, but it changes names and it becomes the femoral artery because it goes along the femur. The femoral artery is going to curl around so that it goes to the back of the leg. So here's the femoral artery coming around to the back of the leg. And it's really busy right here in this section, but we want to focus on this part that goes superior to inferior. So up here is where it's still called the femoral artery, but as it comes down to here, and it's hard to see right now, but this is where the back of the knee is, so that's the popliteal region. Well, that's the popliteal artery. Then the popliteal artery, as it gets past the popliteal region, there's one branch that goes off over towards the lateral side, and what it shows on here, on your coloring sheet, it's a little confusing, but this is going to be the anterior tibial artery. It goes between the fibula, which is right here, and the tibia, which is over here, and it comes out on the front side, and I'll get back to that in just a second. But this part of the artery that goes all the way down to the heel, this is the posterior tibial artery. And the posterior tibial artery branches again, and one branch goes to the medial side of the underside of the foot, and that's the medial plantar artery. And then another branch goes to the lateral side of the underside of the foot, and that is the lateral plantar artery. This other branch that branches off the tibial artery, the posterior tibial artery, and comes down on the lateral side, and I show it ending right about at the lateral malleolus. That is the peroneal artery. And if you remember, we had peroneal nerves, but that is the peroneal artery. Let's go back to the anterior tibial artery. We're doing a fake and break because it has to go between the tibia and the fibula, and on our mannequins we just can't do that. So you have to imagine that it's going in from the back and coming out right here and continuing down the front of the leg, and that is the anterior tibial. For the general anatomy students, you know that anterior means front and posterior means back. So the artery that's on the back of the leg along the tibia is the posterior tibial. The artery that's on the front of the leg along the tibia is the anterior tibial. When this artery gets down to the foot, this is a section right here where I'm not going to ask you to know the name, but we build it anyway so we can show the continuity of the arteries. But then as it curls around over the top of the foot right here, this is the arcuate artery, A-R-C-U-A-T-E, arcuate artery. And then just like on the hands, the arteries that go out to the toes are the digital arteries. All right, so that takes care of that part. And while we're here on the front, this is the genicular artery that goes all around the patella. And when you look at it as it comes around to the back, that's what makes the popliteal region so confusing, is you've got part of the genicular artery coming through here and here and here and here. That's also part of the genicular artery, those 4 branches. All right, let's go back to where the common iliac artery branched off. What I just finished was all of the arteries that come off of the external iliac. So now let's look at the internal iliac. You'll see that there are 2 branches right here. We'll get to those in just a second. That's where the, so this is the internal iliac, and this is where it changes names. And now this artery has a different name because we built it. This is another fake and break, but if you look, this is an artery that comes down, oops, and it looks like it goes through the obturator foramen, largest foramen in the body. So that is the obturator artery. If I ask you on a quiz to label it, I'll stick a pin in it or point to it down here, inferior to the obturator foramen. Those other 2 branches, if you follow them around, they come out and they end up in the gluteal region. So you've got a superior gluteal artery and an inferior gluteal artery. And those are the arteries on the lower part of the body.